Well, this is very exciting. We are having AnaMaria share with us. And I think she disappeared, or there she is. I'm very excited that we are having VitaFlex technique with AnaMaria Diaz Brenson. She is just an amazing teacher, an amazing therapist, and she agreed to show us simple techniques for every one of us to use to go into a complete balance every day, basically. And I'm not gonna wait any longer. AnaMaria, did you say that you actually have a presentation to share? Are we gonna be sharing on a screen? I really would prefer that we don't share any presentation so we can see you, how you are doing it. This, I think, is the best when you are gonna do it. And I'm gonna ask you to unmute so you can actually speak. And I'm gonna mute myself. Again, thank you for doing this for us. We are recording, so we are gonna be able to look at it later. And if you have any presentations, we can actually get them into the group, and that would be wonderful. AnaMaria, your microphone.
Hi, everyone. Thank you, Kate, for letting me share my knowledge, my experience, my testimonials, my love for VitaFlex and Raindrop. I really love this. I got very into the VitaFlex in a very deep way, just because you're gonna hear a little bit about my story. But 10 years ago, I suffered from radiculopathy, affecting my C5, 6, and 7. And if you see here, that's why I was studying this. And I'm gonna be showing this. If you see this here, which is gonna be, I'm gonna be showing PowerPoint, and the main reason is because there's a lot technical words that I want you to get very into it, so you guys can understand that. And also because I know some of you were taking the training as well with care. So this will be a good review for the ones who are taking that training. And for the ones that are not taking any training, but it's a practical to be able to get this in your routines, in your daily life, as a moms, as an aunties, as an uncles, as a doctors, as a whoever you are, this is great for you to keep it in your routines. So we're gonna get from the ones that are having a lot of knowledge, from the ones that are just starting. So I know, Kate, it's kind of like everybody wants to see it, but I'm gonna show you my feet. I'm gonna show you everything. So I have shorts for that reason today, so I can lift my leg and show you all the points. But at the same time, I want you to take pictures. And at the end of this, I'm going to pass to Kate all the information, so she will be able to pass it to all of you. I think this is one of the good things from this is that Gary Young, Dr. Stewart, Dr. Stanley Burroughs, they always wanted to give this to the community. They always want us to share this. This is not to keep it to ourselves. And when we had injured, like the injury that I have 10 years ago, having my radiculopathy, which I was losing my sense of the feelings in all levels. I was losing my sense of the feeling in my emotions, in my mentally thinking, in my physical body. And what that means, I stopped feeling things in my hands, in my shoulder, in my neck, and I was in a lot of pain. Then I was not healing my lower extremity, my legs. I couldn't walk for 2 days, and then I got depression, anxiety, and so on. At that time, I had my second little one, which is Noah, and he was 18 months when I had him, when I had the radiculopathy. And as a mommy, it was horrible to be able to feel that I couldn't play with him the way that I wanted to play it, or I was supposed to play as a mommy. I couldn't even hold a cup of water. I couldn't hold my cell phone too long because I was extremely weak. So I was afraid. And when I started feeling this, my background is occupational therapist. My second specialization is early intervention specialist. And when I was feeling this, I was so confused. I knew it. It was something wrong with my nerves. I knew it was something wrong with my ligaments. I knew that there was something wrong with my muscles, but I wasn't know what was the diagnosis. So I went to many doctors, and the first doctor that I went, it was, and I have to recap this because we're going to be talking about diagnosis probably here, which is mine, but we're going to be talking about why we're using VitaFlex for. And we have books that we can use, and I'm going to tell you where you can have them and how this is important to get it. Because in that way, we can talk based of scientific knowledge, right? We have many books from people that they've been working and figure out how these techniques get together to be able to work as a holistic field. Because that's why we're here. We are not playing to be doctors. We are playing to help us as a community. In my case, I have a license as an OT. I have a license as early intervention. I have a license as a raindrop certified specialist, and I have a license as a healing pivot. I think if we kind of like block. Oh, thank you, Kate. So I have a license to be able to work with this in my own career. But forgetting about that, the best license that I have is the love of loving myself, my body, my family, and be able to be using these techniques every single day with my son. Noah, for instance, I use it every day before he goes to bed. I use it on myself every single day for prevention. After I have my radiculopathy, I think Kate met me when I have in my pain. Edita Granny, who's here, she was one of the first one that I reached out to be able to see how we can get in through the oils, because I had no clue in 2012 what was oils or how is this. So one of my doctors, who is the specialist from my spine, from the Joints and Bones Institute, he was the one who recommended for me the raindrop. I never heard it before as an OT. I never heard it before as an early childhood intervention. I never heard it as a sensory integration specialization therapist. Never heard it. I heard so many other techniques, but I never heard raindrop. So when this doctor recommended me to this therapy, immediately angels are everywhere. We just need to open that door. And of course, always there's a voice there that we want to ignore. But when that voice is knocking to your door harder and harder, you need to open it. So I did that. I met one of my friends, and that friend knows Edita, and Edita knows Margaret. And I have to refer to them because I am very touchable by their knowledge and by their the way that they were approaching to me when I was in severe pain. So I'm really grateful to have these people in my life, especially both of them. And I called Margaret and I said to her, I'm in pain. I didn't tell her that I was having a radiculopathy. I think for me, that idea to be mentally focused on diagnosis, at that time, it was another angel behind my head saying, don't think about it. Don't think as an OT. Don't think what is the worst thing to having a radiculopathy. So I was listening to that little voice here saying, just go for what you are waiting for. And I just heard Margaret. I said, I have a pain, severe pain. I cannot move. I cannot feel. I cannot do things. I have anxiety. I cannot drive. I have depression. I told her all of this. And the only thing that she said, come over and I'll see you. I said to her, I need a raindrop. And she knew it. I was like, oh, wow, she knows what is a raindrop. So I went to her office and she started doing this magical dance with her hands, and this magical dance that you guys going to learn today, or you guys going to reinforce it today for the ones who knows them. But every day it's new, it's a new knowledge, it's a new education. So every day we learn from that. So Margaret is the only one, I'm going to tell you, is the only one who's been touching my back. I'm afraid to someone else to touch my back. And since 2014, I started having the best feeling. I have 2 years of raindrop. I have the third session of my raindrop and VitaFlex. I start doing getting into what is Care Institute. I met Nancy Gouch. She's been my mentor since day one. I also had a lot of information from Dr. Stewart, and Nancy Gouch was sharing a lot of information about how can I apply my oils, how can I touch my spine, how can I work on my emotional release, because this is all together. So that little voice that I mentioned to you over here was telling me, listen, listen, don't get into the pathologist, don't get into treatment, don't get into things that we're as a human being used to, because that's why we always walk like this. And sometimes we don't see alternatives around because we don't want to listen. So I invite you today to be very open-minded, and listen to your heart. If this is for you, great. If this is not for you right now, keep it there, but keep it open. And if this is for you later, amazing. You know, every single touch that we do in our body is a sensation or stimulus that we are bringing to our body in a very natural pathway. Especially we're using our essential oils from Young Living. We all are in the same team, in the same group, in the same family. We know what they are for, and we know how they made with, right? So for the people that is new here, um, the only oils that we can use for this raindrop technique are from Young Living. The only oils that we can use for VitaFlex points are from Young Living. And that's what I'm teaching you today and sharing my knowledge, since I've been getting into deep and in a deeper way to be able to heal myself, my family, and my dogs with VitaFlex and Raindrop, getting together our oils. So from there, having said about my testimonials, I want to open this that we are not going to diagnose, we are not going to treat, we are going to learn. And this is for our own use to be able to touch certain testimonials, and everything is open here, right? So I'm gonna share because I want you to get a very deep, I think, Kate, you gotta pass me the co-host so I will be able to share from my name, just right there. um I want to also share that I have permission from my family. My little monkey Noah, he started also developing a tic disorder since he was 2 years old, and I think it was part of my life at that time, that I was super stressed and having a lot of emotions at balance. So I guess I passed that to him. I don't know. Whatever it is, it is. But I've been doing VitaFlex on him, and it's the best way that we can calm our feelings and also our nervous system. So you guys going to understand today what is the nervous system and why it's so important to calm our nervous system. Okay.
AnaMaria, try now if you can
Perfect.
do the sharing. I would like to add to this that AnaMaria is the physical therapist, but you, OT, occupational therapist.
Yes.
However, the technique that she's showing is absolutely for everyone, and you can do it. You don't have to be a therapist. You don't have to go to a therapist. You can do it all by yourself on your own feet or your family feet. And we would go from there, really.
That's right. That's why we're here to share it, so we all can do it. And one of the first recommendations before we do this is to be comfortable, to be with your barefoot, to be ready, to practice on yourself, on your kids, on your dogs, on your horses, whatever, on yourself, whatever. And after this, we're gonna be ready to go to bed. So I know we're gonna have a good night tonight, and that's what I do every day on myself to prevent any other injury. So there's a lot of cases that I see daily with injuries, and more people is more open-minded to this. So I already introduced myself, and I kind of introduce what is a raindrop technique and VitaFlex. Raindrop technique is being created by Gary Young. Gary Young is the pioneer of essential oils in the world. And it was a pleasure to me to know that he was in Colombia in 2005 and he was teaching actually the raindrop for first time in Colombia, which is the country that I am from. And 2013, that was the first time that I see the raindrop directly from him, which was in Dallas. And after that, I decided that I wanted to be a raindrop certified just because I want to go deeper in my body and also with my family who was suffering cancer, prostate cancer, mama cancer, gums cancer, and then the tick disorders that we have with our little monkey Noah, plasma radiculopathy. And today I can tell you that my parents, my son, and myself, we are free of pain. And every time that we see that there's any pain in our body, it doesn't matter which way it's the pain that you're having it, VitaFlex with oils or without oils work, and you're gonna see why. So from 2013, I met Gary Young for the first time at the Dallas convention, and it was very nice to be able to talk to him and to be able to see this technique closer. Also, I met Dr. Krabner. He is a chiropractor, and he always said, and we have in our books, that if a chiropractor could even learn about the raindrop technique, they no longer will doing those managements that they do with their fingers on top of the spine, just because this is a very gentle technique to do. I'm going to explain a little bit that raindrop has a little bit of VitaFlex, but VitaFlex has their own unique to work in every single organ. VitaFlex is not radio, how you call that? Reflexology. It's not a reflexology. Reflexology, we use our thumb and we do the pressure in the organ. VitaFlex, we have a technique that it has a piezoelectrical impulse that help us to get a voltage through the reflexes and be able to heal, to harmonize, to minimize, to control, and to be in love with our own body by that stimulus, that our own sensations from our hands are giving to that part of the body where we're touching to be able to create a good environment and balance for our body. Literally, VitaFlex is a term coined by Stanley Burroughs from the phrase vitality through reflexes. And I love this because as an OT, I used to work in a hospital with geriatrics and also with kids in the ICU. And I had the opportunity and also my country to be able to be in the delivery room with the doctors and nurses to be able to check reflexes as an OT. And as we know here, that reflexes are the main part of our body to know if our brain is working great or not, right? There's some reflexes that they need to be fade, and there's some reflexes that we have to keep, and some reflexes that we develop to be able to know if everything is working in balance in our body. So when I read this for first time, and then I read this book, and I still reading it and reading it and recopying it and re-practicing every time, because now that I love sensory integration, and we all know what is sensory integration. It's every stimulus that comes from outside that it gets internally in our body, and we can give a feedback and responses to that stimulus. So when I associate that as an OT, and then through what we're seeing right now, it's amazing because we have a response of healing. It consists of a specialized form of dial electrical stimulus, that's what I'm saying, and pats the nails to the fingers in a rolling motion to fire voltage in the body through reflex points. So now I want you to extend your hand, and I want you, first of all, the ones who have nail polish or long nails, you might not feel the sensation that we want to feel. Since 10 years ago, my nails looks like this. So I don't have no nails. And I file them with a special file, which is kind of like crystal file, to be able to have it very soft and not feeling anything. So I can really touch my fingers with the skin. So I want you to do this. If your nails are filed and they're okay, and if you need some time to file it, go and get your file and start filing right now so we can do this class. And I forgot to tell you guys about that. So while you're taking your file, I just want to explain that in the raindrop, we have a technique that we call the feather technique, right? So if you do this, this is what we need to feel. There's no pressure. We just need to feel like our fingers are feathers. And if you do this, and if you feel that you're getting goosebumps or your hair is electrical, that means that you're doing the right technique. You're doing the feather technique. Now, I want you to close your eyes and I want you to feel that sensation. And just imagine what is that. You just feel it. Just feel what is that sensation doing to you. And that's what we want to do. We want you to feel that. That's a VitaFlex. We don't need to feel any pain. When a person is in pain, we don't want to give him more pain. We want to release it. We want to harmonize. We want to keep in balance that part of the body that is in pain. So this is especially what we need to feel. Once you know that, we're going to apply the technique. The technique called VitaFlex is you put your hands against your skin in this way, all fingers together. You're going to bend your fingers and you're going to flex and you're going to extend. Flex, extend, flex, extend. And then start bringing those fingers all the way up to that pad, right? So that's what we want to feel. We want to feel that. And if you close your eyes, keep doing the technique. Sometimes it's not easy in the beginning, but this is practice. Sometimes we born with the ability, but we need still having more practice, right? For those that are massage therapists, you guys have to work hard in this because a massage therapist if they see that there's a spasm or there's a tender or there's something that they want to kind of go through a deep massage, no, this is gentle, very gentle. So let that imagination, close your eyes and just feel like that's a little, I don't know, it's a feather walking on your skin. Okay, once we practice that, how VitaFlex works, when we do this, we're feeling it already, that there's something that is in our body. Somebody can tell me, what did you feel while you were doing that? Someone wants to give us, if you have any sensation while you were doing your VitaFlex, when you close your eyes. Or if you don't feel anything, be honest that, hey, I didn't feel it. We need to know you're doing the right touch. So someone wants to kind of like open the microphone and say, what was your feeling? It's amazing. I love it.
It felt very relaxing.
It is relaxing. Annette, were you under stress today?
Yes.
And you feel relaxing with this?
Yes, this was relaxing, yes.
Good. And when you close your eyes, there's any part of your body that was getting kind of like chills or maybe something else that you're
No, I just went like, ah.
Just once relaxed. Good. Very good.
Yes.
Okay. So we need to have a little bit more light touch. More light touch so we can feel the voltage that the VitaFlex is producing, right? Especially for people who has pain, they don't want to feel any pain, any pain. So what it does, it voltage produced by VitaFlex induce current along the nerve pathways, the molecules of the essential oils, and this is the part that we need to highlight. The VitaFlex work itself, it does. Because there is the book that is telling us by Stanley Burroughs, and he has all the techniques of VitaFlex right here. But Gary Young has a beautiful research why oils work itself as well. When they combine these two, we can see that we have a full healing approach. So the oils, they have molecules, and those molecules go through our skin. When we are touching by VitaFlex, we are opening receptors in our skin. And when we open those receptors, we are allowing every single drop of oil to have that pad with a very big voltage and that electrical nature from the oil, because it has their own abilities to heal by their own chemicals in their plants. So we are adding a power of not only the touching, but the oil itself. Remember this, sickness is often the result of a blocked nerve pad. And that happens to me. For some reason, I was stressed probably. I had a car accident in 2005. I didn't heal myself the way that I was supposed to. And then I have a kid after 20 years, and then I moved to Chicago, and then everything went kind of like over stress. Stress is a very #1 sickness today in the world. And stress block everything. Block physically, mentally, emotionally, and etheric body. So if we close that, we start getting pain. So be careful with that. VitaFlex helps to move the healing molecules of the oil along the pathways. If I put an oil in my palm and then I do this synergy and then I put it where I wanted to work on, and I start doing this VitaFlexing that part of my body, which is a reflex point. Of course, I'm opening everything and I'm letting that oil to get in, to be able to travel to our bloodstream and to be able to go and heal the cell that it was unbalanced. So that is the way that VitaFlex and Raindrop works. Now we're going to go through the why we do VitaFlex in our feet. Someone can tell me why we do VitaFlex in our feet? If someone tells me, I have a prize for you, the first person who answered that, I have a prize for you. Why we do VitaFlex in our feet? There's 2 answers for that.
Because that's where all the reflexology points are.
We don't talk about reflexology. We talk about reflexes.
That's right. That's where all
That
the
is one
points are.
answer. That is one answer. Yes, that is one answer. And then you get one prize. Where is the second one? Why we use our feet to apply our oils. And Annette said, because those are the reflex points. So true. They're here. Reflex points. We're going to work on that tonight. But why is the second one when we apply oils? Because oils are what? Somebody said something.
Stella said because it absorbs all the organs.
If I put an oil here too. Or if I do it here, my organs go through my bloodstream, right?
Right.
Okay, so no. But you got a surprise. You got one of this. One of this Rolans with a heart.
Thank you, but you don't have to. It's okay. Thank you.
But okay, nobody knows that is because we have a lot of oils that are very hot, right? They're very hot oils. And if I want to apply those hot oils, for instance, if I have sinus, which I do have that sinus since I was little, if I have sinuses, well, if I apply clove or mint or eucalyptus, what happened to my skin? It's very sensitive in the face, right? And it's very close to my eyes. So I don't want to apply any oils in the areas that are very sensitive. So the feet has the thickest part of the skin. And that's the way that we can apply oils, even without a carrier oil. With my experience, I trust myself, and I'm okay applying oils directly without having any carrier oil. With infants from 0 to 3 years old, I always apply a carrier oil. And one is because they haven't even touched the floor yet. They haven't even used their feet to walk. So we have to apply a carrier oil. 3 years old, they're already getting into the path to walk, but it's still very sensitive skin. And even with my son, sometimes like a peppermint or clove, I can apply, or teas, I can apply without a carrier oil. But maybe oregano or any fennel oil, it could be too hot for them. And also for little ones, we apply carrier oil just because we want the oils to do kind of go slow inside of their body. For grown-ups, like 12 years up, we can apply the oils without a carrier oil. So that's the first thing why we use our feet to apply the oils, plain oils. Okay. Connections. This is super important. That is why I was showing this map. When I have a client here, and for me to remind that the spine is the alignment of our body. The spine. If we have any pain in our ovaries and our prostate, if we have, well, the males who are here, if they have any pain in the prostate, if we have any pain on the kidneys or adrenal glands or lungs, or probably right now with the COVID and the pandemic that we're seeing, this is one of the techniques that I've been applying since last year. I had everything. I have a virus, I have Epstein virus, I have H. pylori last year, I have anxiety, I have depression from March 14, 2020. I almost kind of like went through the same thing as 10 years ago. But I went through it, I'm okay now. So I always remember myself that every single connection is directly to our spine. Our spine has a very nice function and very important function in our body, which is connected to the brain. We have a medulla inside, and the medulla is the one that is bringing that information to our brain. And if we damage the medulla, which happens to me in 6, 5, 6, and 7, well, we're not going to have information to do certain things or sense, right? So what we do is spreading the oils through our reflex points in our feet and be able to kind of get to those points and embrace those organs that might be feeling alone or away or in denial, because that happened to us. That when we apply oils in those VitaFlex points, what we're doing, we are opening the receptors of our body to be able to change, to be able to heal, to be able to reprogram. And that's what we're doing with the VitaFlex on our feet, right? Hands, same thing. I love to do VitaFlex in my hands. Some of you may be seeing me doing this in my spine and then my head. And I'm like, yeah, I'm doing it. Oils or not oils. When I'm doing it in my hands, I do not apply oils. Why? Because sometimes I'm just get too used to apply very hot oils, Fennel oils in my feet. And then if I don't remember that, then I apply it in my hands. And when I touch my face, then I will be crying because it's close to my eyes, right? If that happens, we all know that we have, or maybe you don't know, we have to take the carrier oil to be able to get that burning sensation if we apply hot oils. Hands, I just use them when I am in the meetings where I'm home, or maybe I'm feeling that my nose is blocked, so I'm just doing my sinus, and that is the way that I'm unblocking if I cannot have an oil immediately, okay? And before we start the practice, we need to know our body organs. We need to know where they are physically, right? Especially the colon, because when we start doing the clearance of the colon, it was started with the left, you know, the descendant colon, and we're bringing everything inside. Guess what we're going to be doing? We're bringing everything that our body needs to get away, and we're bringing it in to keep it in, and we're going to be very, very inflamed, or maybe with colics, or maybe with more pain. So we have to know our body organs. So to do that, we can keep our microphones mute. If you have any questions, just feel free to open it, to open the microphone. We're going to start from our trachea, right? So we're going to see where is it. We're going to move it. So swallow your saliva and touch it. We're going to move it, right? We're also going to touch our thyroid. Touch your thyroid. Pass saliva and touch to your thyroid. Feel it. Feel it. It's okay. Feel your veins, right? When I do like this, I'm like, oh, look at my veins, right? Your lungs. Feel your lungs. They're actually in the back, and this is the bronchial area. But if you touch over here, you can feel how are your lungs, right? Touch them, embrace them, say hi to them, right? Touch your heart, which is not here. We feel it here, the reflex of the heart, but the heart actually is in the back, right? So touch it, embrace it from in front and back. Our liver is in, I'm sorry, yes, our liver is in this area. It's not up here. It's kind of like in the middle all the way up, right? Our spleen is in our left side, so feel it. When you run it, you feel that kind of like weird sensation there is because you're out of breath, or maybe you are not hydrated, or maybe you are making your spleen work faster. Then you start kind of like, oh, I have that spleen pain. So it's on your left side. On your left side, the pancreas also, kind of like if you go 4 fingers down from your ribs, you find your pancreas. And also in the right side, we have both sides. We have our kidneys. With both sides, we have adrenal glands. Both sides, we have lungs. Both sides, we have our intestines, our small and large intestines. So when we're going to talk about the large intestines, we're going to start talking about that they go from the right, from the bottom, all the way to the up, and then they cross the stomach, a little bit lower from the stomach. They cross a little bit lower from the stomach to the left hemisphere, and then they descend. That's the descended intestine, and then they go to the back, and it goes to your sigmoid, and then the rectum. That is very important to know when you're going to do VitaFlex, and we're going to practice right now. Again, your appendix is on your right, your bladder is kind of like in the middle, and your rectum and urethra, it's all the way to the back to be able to flush what we need to flush from our body, right? So now we're going to a real practice, and I'm going to show you my feet, and I'm going to show you the way that we do the colon. There's 2 ways. I'm not going to do this class as the class for VitaFlex, like 2 days practice, because it's very long and we have to practice. This is for you to do it at home, to do it to your family, and to start practicing today. So VitaFlex technique for clearing the colon. The tech administer not only the colon, and as we see in the image before, we administer also the ovaries, bladder, sciatic nerve, spine, thyroid, and brain, right? That's why they call it, that is the 3rd brain that we have in our body. The brain, the heart, and the digestive system is the 3rd brain in our body. If we are congested in our digestive system, our heart is not going to work the same, and our brain is not going to think the same, right? So they go vice versa. With any issues we have here or here, they just always kind of will work as a team. So I'm going to put this down. So you guys are going to be seeing my feet. And to start working on our colon, there's 2 ways that we're going to be working on our colon. The first one is going to be working on the colon, starting from your knee, the right knee, and you're going to find the tibia, that it comes over here. You guys can see it, it comes over here. So we're going to apply any oil. What oil we should apply? If we want to release any flatulence, if we want to release an inflammation, if we want to release congestion, if we want to release any pain, or in our ovaries or prostate, or any area that is related to the digestive system, we're going to start working from here. If we don't know that it's just the colon and maybe it's around it, remember that everything has a reflex point, right? Everything goes to reflex. We don't know, we might feel it in the digestive system, but it's not in the digestive system. Maybe it's around the digestive system. So that's why we're talking about other organs. So
AnaMaria,
yeah.
would you be able to stop the presentation so we can see you on the whole screen? Otherwise, you are very small. It might be really difficult. So if you stop the presentation, the screen share for a minute.
Do the practice? Yeah.
Do the practice, yes. I think will be very practical to do that. Thank you.
Let me see. Could you guys look at the full screen there? I'm trying to see. Okay.
Yes,
See
we
it
can
now?
see you, so that's good. That's
Okay.
very good. Thank
So
you.
if we do distracted with the colon, and we want to see everything around that is not just only the colon, but is affecting the colon, we're going to start from our knee, right? And we're going to start from the right side, just because that's the way that the colon goes. So we're going to be using, we can use DiGize, we can use Cypress, we can use Peppermint, we can use any oil that is related to the digestive system. Fennel, we can use cilantro, we can use celery, it's amazing, but I'm gonna use DiGize. So first we're gonna work on the right leg, and our hand, our right hand is going to be our plate, right? So we're going to pour 3 drops of each oil. And we're going to work on almost like a 6 centimeters just to make that synergy. And we do 3 drops of the oil. We let the oil 3, okay? And with our tops of the fingers, we're going to do the synergy. And we're going to start working on doing VitaFlex in our legs this way. And then we're going to go all the way down through the bone. You find your pad there, and you're going to do your VitaFlex. There's no pressure here. It's just doing the VitaFlex like this. So we're not just only touching the digestive system. Now we go here, where are the ovaries, prostate for males, and ovaries for females. So we go around the ankle, and then we're going to go all the way around our heel, right? And we're going to stop right there. So when I'm going to start just with the digest or colon, we're going to stop right here. We do this 3 times around the knee, and then we go all the way down 3 times. We just need to do it 3 times. Unless you want to do 3 times in the morning, 3 times in the afternoon, 3 times at night, and then will work for you. But 3 times you will be feeling a good release. So we'll be doing this, okay? And we go all the way here. Now, if you want to work on your spine right away, you can do it because you're embracing other organs, okay? But now we're not working just only in the digestive system, we're just working and embracing other organs, which is okay, okay? Same thing, whatever is left, we put it on your plants of your feet, right? Now, if we want to work the other hemisphere, we have to do it. We do exactly the same thing. Now, our hand, the one that's going to hold the oil, is the left one, 3 drops. And the hand that is going to provide the service is the right one. So we do exactly the same thing. Oils needs to be here. You see that? So we're going to do our VitaFlex underneath of our knees. We're going to find the bone, and we're going to go all the way through that little bone. And we're going to feel it. We might feel some uncomfortable pain, or maybe something that is not related to a feeling that we want to feel. And then we go all around to your ankles. And we stop right here. Or you can continue doing your VitaFlex on your spine, right? And we do that 3 times. That's what I do every night. Especially for those that are gluten-free, or maybe dairy-free, or maybe you guys got something today that is not good for your stomach. You will be amazing because we are stimulating our enzymes from the reflex points and minimizing inflammation and probably, I don't know, things that can happen there, right? So we do that 3 times. Whatever is left, we put it in our feet, okay? That is one way to start the VitaFlex to clearing our digestive system. The other way is exactly when we do this training, oh my gosh, we are full of oils. It doesn't matter. They're good for you. So don't be afraid that you're using or overusing oils. The molecules just absorb and they just go away and they fix what they need to fix and done, right? So we're going to use DiGize again. Or if you want to use another oil, you can use it, peppermint. So now, because the digestive system start from the ascendant to the right, we're going to be working here and we're going to VitaFlex here. And then we're going to cross all the way to the middle of the foot and crossing to the left foot and going all the way to the side. Then we're going to come back to the middle and then we're going to go to the sigmoid and then the rectum. So I'm going to show you that. So we have the left, I'm sorry, I put the oil in the wrong hand. So I put the oil in my right hand, 3 drops. With my left hand is the server. I'm going to start getting my points where I'm going to be working on my colon, ascendant colon, which is right here. You got your heel, and then we got ascendant colon. We have an arch, and for the people who doesn't have an arch, is you have this bone right here, and then from the bottom of that bone is when we have to go through. Okay, so we're going to start here, put the oil. We're going to work from the heel all the way up before touching the bone, and we're going to cross our foot. So we are working on the large intestine and the small intestine, right? So here we have oils in this hand. So now I'm going to do this, and I'm going to pass oils to the other feet and the other hand. Now I'm using my right hand. It's comfortable for myself. When I'm doing it to another person, I don't do this, but we're doing it to ourselves right now. So I go all the way to the edge of the foot. I'm going to go down a little bit, and then I'm going to go to the middle of the heel, and then I'm going to go all the way down, which is the rectum, sigmoid and rectum. So we do that, and we do that 3 times. We have oils in the finger pad, so we go all the way, and it feels amazing. It feels really, really good. And then our fingers have already oils, and our feet too. And then we go to the left side, transverse colon. We go all the way to the edge. I'm going to move my fingers down a little bit. Then I go a little bit to the middle, sigmoid and rectum. And then I go down 3 times. So with that, we already did the colon. Whatever's left in our hands, we just do this, right? DiGize is not a hot oil, it's very gentle oil. It's okay oil. So it's not gonna be burning anything. We can do it directly, and it's a blend, right? So we can do that. So what we did is just working on this area. If you see this VitaFlex points on your reference book, they are very clear. So you just kind of do your VitaFlexing there, okay? If I'm doing it to somebody else, I'm facing my client. I am aligned to my client. So I don't have to do this maneuvers, like switching in here. No, I'm doing it for myself right now, right? So my right hand goes to my left and my left hand goes to my right. If I do my right, when my right is kind of like going to be crooked. So I figure out that this is a very good way to kind of like pass the middle line and do my VitaFlex for my colon. But if you're doing to a client or to your aunties or to your kids, you align your kids and just start doing it. Okay, with one hand is the one that supports the oil, and the other hand is the server hand. Okay, I'm gonna share the next screen, which is here. And now we're going to the lungs. Why lungs? And especially right now, or even not even right now. I never think about the pandemic or anything like that. I just think the way that I feel and how my nose works and if I'm okay. And if I travel, if I'm in the mountains or whatever, I always kind of work on my lungs and bronchial tubes. Oils for infection. We need to know that those are the severe oils. Those are the oils that are there for infections, right? Tips, Exodus 2, immune power, cistules, that is also the Rose of Sharon or the Rock of Rose. Why these oils? And maybe you say, there's no peppermint in there, right? Even though peppermint works for infections too. But this is the power oils that go deep on the pleura and they work in the pleura. I learned that from Stanley Burroughs, why we have to get deeper in the pleura and why these oils. I learned it deeper from Dr. Stewart. So this is why. And if the infection is viral, now we use oregano. And remember where we're living now. That little thing that is going around is a virus. And it starts from the viral and then goes to the lungs, right? So we need to use oregano. And we know oregano has a very, very good property that is the carbacrol. Carbacrol is a killer of the virus and bacteria. That is why today you have to order oregano and get it every day in your blends, every day in your feet, every day with teas. That's what I do. Because it has carbacrol and it's a killer. So thyme, cinnamon bark, and cassia. Those oils are amazing, amazing oils to kill any virus. And also we have for phlegms or for mucus that we have frankincense, we have hyssop, we have eucalyptus, either one, blue, globulus radiata, either one works for it. We have Raven, we have Racine, we have Ravinsara, and we also have more oils, but those are the typical oils that we can use for that area. So now I'm going to go ahead and stop sharing, and I'm going to share with my feed. Okay, where's my picture? Right here. So when we do that, I don't know how to do the big screen. I'm on the big screen. I don't know. Anyways, we have the lungs. The lungs are here. So there's a bone here, and we put one finger between that bone, and then we have the digestive system. So the lungs go that finger all the way up, but doesn't go close to the toes, okay? So it's kind of like in the middle, and we have two lungs. So one is on the right and one is on the left. Don't get confused with the colon. The colon, we just have to go through. With the lungs, it's totally different. Oh, wait, hold on 1 second. My dog's got here. Wait, I'm going to pause this for. Okay, sorry, guys. My dogs are playing around me. Oh, they're going to start barking. Okay, so we have the lungs right here. And the way that we're doing it is like this. Same thing. In your bed. This position is the best position to do it. So we are here sitting crisscross applesauce or prana yoga position, and we're going to apply the oil. I feel okay today. I don't have no infections, anything like that, but I'm going to prevent, or I just want to work on my breathing and breathing system, right? So the same thing. I'm going to put the oil on my right side because I'm going to work on my right foot. And I'm going to put eucalyptus radiata, 3 drops. My left hand is the one that is going to give the service. And I'm going to go, which the organ is right here. But we're going to start from, this is the shoulder actually. So we're going to start from here and we're going to VitaFlex this way. right? And I can be like this, but because I want to show you how I VitaFlex, that's why I'm lifting my legs. So my hand is here, and this is the one that I'm providing. So I go from my right part of the edge of my foot, and then I go and stay there for a little bit, and then go all the way to the center of your foot. And again, you do it again 3 times, it's enough. We're doing VitaFlex, which is a voltage, and we are doing oils. So we have double stimulus in our organs. So you do that 3 times. Whatever is left, we put it here. Okay? Same thing with the other foot. Our left hand is the one have the oil, and our right hand is the one that is going to provide the service. So we go from the edge all the way, and we stay a little bit in the middle, talking to the lung. Be nice, be healthy, close your eyes, enjoy that massage, that touch. Just bring the best vibes to your organs. And then go all the way down with your fingertips 3 times, and go here 3 times, and go here. Okay? Whatever is left, I'm going to put it in my foot. Now, I'm going to go ahead and cover nose, sinus, eyes, and ears. Now that we have the same oil, we're not going to use another one, but you can use, if you have ear infections or you have any infection on your eyes, you can use eucalyptus, you can use purification, you can use rose of Sharon, any oil for infection. So what I have, my food is already full of oils. So what I have is I'm going to go ahead and put my fingers right here and going to do the VitaFlex on my sinus. This is the sinus. So I'm going to start from my, it doesn't matter which foot you're going to start, because we're not doing colon, we're doing just the sinus, right? And it has already oils in it. And we're doing this because we are at home. With my client, in my visits, I have to put an oil and I have to do it in a different way just because it's a client, right? But when we're home, we want to be practical, especially with kids. The moms who have little ones, they don't want too much touch in their feet, so we do that, right? 3 times. Now, we're going to go to the ears, and we're going to go to the eyes, and we're going to go to the head. So you put your hand right here, and you're going to go all the way up. From the sinus, all the way up. From the sinus, all the way up. From the sinus, and touch your thyroid, which is right there. And go a little bit up, and keep your fingers on your pineal gland, which is right here, in the middle of the toe. And go all the way up. And do it again, from your sinus, all the way up, from your sinus, all the way up, from your sinus, all the way up. 3 times. Same thing with the other foot. From outside to inside, sinus. Sinus, this way. Right? Sinus, this way. And then you're going to support your fingers, and you're going to go ears, ears, and then you go eyes. If someone is telling me, no, AnaMaria, the eyes in some charts they show here and the other ones here, that's okay. That's okay. The order here, it doesn't matter because we're touching everything, okay? And the brain. Keep your thyroid, which is right here. Massage it. And then go a little bit up and stay in your pineal gland, which is the pineal, which is the mother of the gland, of the hormone system. So we go like this. Right? And we do that 3 times. Okay? So we cover lungs, sinus, ears, eyes, and part of thyroid and part of the pineal gland. Now we're going to cover the bronchial area. Bronchial area are on top of your feet. On top of your feet, the skin is different. So be careful if you are using oregano or any fennel oil or menthol oil, because you can get redness or burning sensation. If you are used to oils and you know that that's going to be happen for a little bit, that's fine. But if you have a little one that you're working on the bronchial area, well, I really suggest to have a VC oil or any carrier oil first, and then add the oil in your hand. Same thing, you're going to use eucalyptus because we've been using it for the respiratory system. So we do that with the oil. We can use Rose of Sharon. Remember that we have a severe infection, so we can use it. I don't have a severe, but I love the smell. So I'm going to go ahead and use it today. 3 drops, and apparently I need it, right? Prevention. So we're going to do, look what happened here. I'm crooked because I start with my right. If I do this, I will be starting with my left. So from outside, you're going to start doing it. On every single ligament is a reflex point on your bronchial tubes. So we're going to be doing this 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. You get an oil. 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. Okay, and the last time. And then you do exactly the same thing with the other foot. Now, I'm putting it in my left hand, 3 drops. I'm getting my fingertips full of oils, and I'm going to start doing the voltage with VitaFlex. This technique, actually, what we call here, we call it piezoelectrical impulse. That's the piezoelectrical impulse that the technique does to be able to work on the reflex points of the bronchial, in this case, of the bronchial tubes. That's what we're doing right now. So 3 times. And Rose of Sharon is a very gentle oil. It's not that warm or hot oil, so you can use it directly. But if you're using tips or oregano or any other oil, you might get rush over here. So we covered already all the bronchial area, all the respiratory system. Any questions so far? Okay. If there's not any questions, we're gonna go.
I would like to reinforce the fact that we are working from the outside of the food into inside of the food. And that's important, especially with the lungs and the respiratory, because you are bringing it in versus getting it out, if you can think like that. So it's from the outside, inside, if you look at the food. And for the bronchi area, we might not know what we mean. You just go through the between the toes. It literally is the space between the toes, the empty space. Okay, and AnaMaria, you are doing an amazing job explaining this. I would like to reinforce that this is just a touch, and literally just like having finger on and just rolling it over. So from the tip to the nail, basically. And you are just moving it at your own space, even if you have to go a little bit higher, you know, like I don't want you to think that you are lifting because you are not supposed to lift, but you are literally going like a movement. You are creating the movement, and there is no right or wrong. You can go slower, especially in the beginning. It's very, very important.
Just give it the time to it, and that's right.
Right, and I would like to actually also talk about the ears and eyes, because sometimes people say, oh yeah, but some charts showed here, some charts showed there. Think about your own face, just like your toes are. So first you have ears, and then you have eyes. So basically that's how you look at it, at the food, and then is the head on both sides. So
and again, it doesn't matter which order you go, because anyways, we're covering it. So it's fine. And I remember Gary and saying it, the doctors were saying it, don't worry if you see a chart from whatever East or Western, Chinese or Japanese, or I don't know, that they put it differently. No, we're just touching them. We are working where we need to work. And I want to bring up that Kate mentioned that why we bring it from outside to inside, because we want to work on what? On alignment, right? Our body. Okay, so now heads. If nobody really have any question, we're gonna go with the head. Oils on the head, and I love this practice. Why? It's amazing when someone does it for you, like everything. But when you're doing it yourself and you don't have nobody else, or the person doesn't want to do it because doesn't want to touch oils, whatever, we have different ways to do it. The first way to do our head is using our fingers. You can do it in your hands by just doing VitaFlex. Okay? That is why I always touch my spine. That starts from here. And I work on my spine when I have headaches from migraines, and I do this, right? And I keep my fingers there for a little bit more. And if you close your eyes, this is extremely relaxing. Actually, I had a client this morning in my class doing VitaFlex that she had a headache, and we did a Reiki, we did something else, because we are open-minded and we can do and integrate all the good stuff, right? There's no wrong with that, okay? Or we can use our feet. Same thing. We can use our feet if you want to do it on your toes, okay? You can touch your head just by doing this. VitaFlexing, it doesn't matter which side do you want to start.
you have a request for a bigger screen again.
Okay, so now I'm going to stop here. And remember, feet, heads. And when we have headaches and migraines, we don't know where migraines came. Hydration, maybe you didn't eat good enough today, maybe you ate too much sugars, maybe, who knows? So the first thing that I suggest is put peppermint in your belly button and put DiGize. That will work. But if the headache continues, because you probably are a person who has migraines, like 3 years ago, I have a mini stroke, and that helped me before I went to the hospital. So I put in my belly button, I put peppermint and I put DiGize right away, because I was not feeling right. I was feeling awful. So I put both, one drop in my belly button, one drop of peppermint and DiGize. In this case, I love peppermint for headaches. Peppermint is one of the oils that calm, that numbness, that is anesthesia. But also, I love aromatase or aromasis. And what I do with aromasis, I love to have it in a raw one. Why? Because when we have headaches, the first thing that you want to do is massage your head, right? In a very gentle touch. So with the oils, what we do is we start from the occipital area, which is right here, right? And what I do is just kind of like go with my oil like this. And I go to the other side. Oh, it feels so good. And then I do like this, right? I love.
Can you show that again? That was quite quick. Can you show that again? So you go first from the middle of the neck, or you go behind your ear?
It doesn't matter in this case where you're going to put the oil, but it matters where we're going to start the VitaFlex. So if you're going to put the oil directly, I use roll-on and I do this, right? Because I'm going to go ahead and spread that oil all the way to my head. If I'm doing a drop, an oil, which I'm not going to do it because I already put a lot of aromasis, I do a drop, same thing in my hand, 6 centimeters from my hand, and I drop a drop on my hand, and I do this, and I start doing VitaFlexing my head. Remember that I forgot that we have to take our jewelry. So I already have an oil in my hand. I'm gonna get it like this, and I already have an oil there. So what I'm doing is I'm going to be VitaFlexing from this area right here, which is the occipital area. And we are going to do with our VitaFlex, we're going to go around the ear, all the way around the ear. And I'm going to bring that oil to my temporal right here. And then I'm going to do it again 3 times in the same path that I started. Oh, and I can feel it right now. It's so refreshing. I don't have no headaches, but it feels amazing. And then we do 3 times, and then you go to the other row, making like little rows. And then you go, we're gonna mess up our hair here. It's okay. Okay? And you go all the way to the middle of your head. Okay? And then you go all the way to the back. I don't know if you're seeing it. And you go all the way to the middle of your head. Okay? When we do this practice, and it's someone that will have headaches. Now you do with the left to the left side, left hand to the left side. Same thing. Now you already applied my oil, but if you don't have an oil, you apply it on the right hand, and then with your left hand, you get your oil and start doing VitaFlexing from the bottom of your ear all the way to the back. And you do this 3 times. 3 times. We have an oil in our hand, and then you get an oil, and you do 3 times. If you have a severe headache, it might keep you 20 minutes doing it. But because we are in a class and a video, we're just kind of doing the intro, right? And we go all the way to your forehead, right here, okay? You keep doing that from the bottom of your head until you are in the middle of your head, and you keep doing it, right? Until you connect the middle of your forehead right here. Now, when we're done with that, you're going to start pulling your hair from the scalp, very gentle. Pull your hair, pull your hair, pull your hair. For males, like my husband doesn't have hair, just kind of just go whatever they have. That's why you cannot have nails. Because if you have nails, you're not doing it. They're not feeling what we need to feel. So you start pulling it and pulling it and pulling it. And then after 20 minutes, your headache is going to be less or is going to be gone. And if your headache is because you didn't eat right or you're needing the right food, that's why we put in peppermint in your belly button. Now, if you want to do internally, before we do this, we can do a capsule. If you don't like the flavor of the peppermint, we can do a capsule. DiGize capsule, peppermint capsule, or tips. Or if we know that it's something that is viral, what oil we should be using? Which one? Carbacol, oregano, right? So that's the head. How you feel after you do that? Amazing, relaxing, right? Now, oils are not oils. The way that we know we're doing it right is when you look at the mirror, your eyes, how's your pupil? Dilated, right? We have 2 frequencies working there, or maybe 3. They are the frequency of the oils, or we have the frequency, the voltage from the VitaFlex, and also we have the frequency of the love, right? So we're working in everything there. Any questions about the head? Sandalwood, frankincense, cedarwood, brain power, peace and calming. Aroma says pen away for calming. If the headache is because we are stressed, those are the oils. If the headache is because we're not eating healthy, we're hydrated or dehydrated, or we have a virus going on, we use the other hot oils, fennel oils, oregano, thyme, basil, marjoram, wintergreen, or we use the peppermint, which is menthol oil. Okay, and this is what we're doing right now. We start from the bottom of the skull and we go all the way behind the ears. VitaFlex from the heart. I'm gonna stop here. It is beautiful and we should be doing every day, especially if you're watching a lot of news. I'm not, but if you're stressed, this is our left hand and this is the finger that we use our ring, or this is the forefinger. So we're gonna do like a V, and when you close the V, you're gonna touch the hardest part in that muscle, and you don't find anything like that. So that one is our heart. So be grateful and you start VitaFlexing with your index this way, this way. Close your eyes and send the best vibes to your heart. It's amazing. Now, if you want to go deeper, you're going to cross the line from there and you're going to go to your anterior ligament behind the elbow. There's a spot right here that hurts, right? It's right here is the bone, and there's a spot right here that hurts a little bit. With your finger, you're gonna VitaFlex. Dr. Stewart said in one of his stories that he had a client that was having a heart attack, and he came before 911, and he put Aroma Life right away in the finger. I put it here. I do this, and I VitaFlex and VitaFlex, VitaFlex and VitaFlex. And while someone comes to get that person and bring it to the hospital, we can do a lot. Now, I was thinking a couple days ago when I was giving this class, wow, this is amazing. Who is going to provide a CPR right now during pandemic? Nobody, right? CPR is not there, right? So what we do, first, open your oil, let the client or the person who's in need, let it smell, peppermint, Aroma Life, Trauma Life, Helichrysum, any oil that is related to Cypress. I'm going to tell you something about Cypress, a secret. Cypress, and open the oil close to the nose of that client and start pumping the heart very fast, very fast. It's painful.
We actually have a story in our own group that the wife have saved her husband through that. And she actually took, with Edith and I, we took the classes with care and we learned that. Yeah. And yes, she did save the husband or when she went to the hospital the next day because he needed to go to the doctor. They could not believe that he actually lived through that massive, massive heart attack. So, yes.
It's oils, molecules, voltage, touching, heart, energy, all together works. Don't be afraid. You know what? I had an opportunity in one of the airplanes flying to Colombia, and they always happen things, right? Who is the doctor? Who's the therapist? Who is blah, blah, blah. And I raised my hand and I said, someone is having, they don't know, they said heart attack. I always carry my Aroma Life. Aroma Life is one of the oils that is with me in my purse. Not only for my heart, for beauty. Did you remember 2013, we have a Japanese lady teaching that? So for beauty. So what I did was like, me, I'm not a doctor, but I'm a therapist and I can help while we do something, right? I did that and the person actually was good and we could get to the airport until we have the paramedics. So we can help. We can help. Don't be afraid to help. Do it. Do it. Do it. Especially right now. Everybody's afraid right now to help. No, help. And that's a good way to help. Spreading oils in the environment, right? All right, so now we're going to, we have Cypress, Aroma Life, Cypress or whatever you want to call it. There's different accents for it, right? Cypress is a magical oil. Cypress is an oil that we have in the middle of the raindrop. Why? Why we have Cypress in the middle of the raindrop? We have oils to open receptors. We have oils to work in the voluntary muscles, not voluntary muscles. We have oils for release, but we have Cypress in the middle of the raindrop before even going to a free technique and then before Valor. Why we have Cypress? Now, I learned this from Dr. Stewart. And Cypress is an oil that help us to reprogram our DNA. Trauma, a lot of trauma we see right now. So it smells Cypress. Trauma, it could be anything. I have my kid, soccer game, a ball punch him in his stomach, he get without air. That's a trauma. Boom, Cypress. We're going to let that momentum go away, reprogram, and forget about it. And a lot of circulation. So Cypress is the magical oil when we have any type of trauma. That's why it's in the middle of the raindrop. And that's why in the beginning people start kind of feeling certain kind of things, panics, or maybe too relaxed, or maybe who knows. But when we get to Cypress and what we do with the Cypress, you know what we do, right? On the line, we put apart, circles, and we do that, we are reprogramming our DNA. Okay, it's a good stuff. Reference books, Healing for the Age of Alignment by Stanley Burroughs. I extremely recommend it to get it, to learn it, to relearn it, to practice. Our huge book, the Essential Oils Dex reference, is not that deep. They just talk a little bit about VitaFlex, but not too much. They're more into raindrop than just especially VitaFlex. And remember, we can only use Beyond Living essential oils. We cannot use anything else. And I just want to give you this phrase: difficulty with healing, look upon in the right way, is called education. When the mind is brought into harmony, the body heals. And it's just right like that. When we are open to heal, we have to learn it. Which way? I don't know which way. I can tell you my way. I learned from a pain, and now I live in harmony. No pain, zero. Same thing with my son, my mother, my dogs, and all the people that has been healed by education. Thank you so much, Kate. I really appreciate that you let me this space to share what I love to do.
It's been wonderful. I really appreciate that you wanted to take this opportunity and share your knowledge and your amazing skill of teaching and sharing. I will just touch on the fact that for years now, if not decades, really decades, over 140 years really, we've been actually told that it's good to be sick and everything is actually sickness and disease. And the truth is that our health is in our own hands. The more we spend time in nature with nature, the better off we are. And the reason we are using Young Living oils and only Young Living oils because they are created as close as they are created by the Creator, containing the molecules and the constituents that our bodies actually are seeking on the road to healing. And because they have the capability of crossing the barrier, the membrane of the brain and the cell, they are helping us on cellular level to get back to balance, as it's easy to get out of balance these days, especially now. So these are simple techniques. You might feel this is overwhelming if you've heard this for the first time, but the technique is really simple. You can literally watch TV and just walk anywhere over your body, over your legs, over your chest. This is just a technique of turning on and off the electricity that we naturally have, we all have. So it's wonderful.
We
If
are
you have
energy.
it's all energy, correct. So I don't see questions.
All right. So I'm just gonna go ahead and give you a good night today. So we're gonna do a breathing prana technique just to kind of like get that oxygen going on for the ones who have a lot of oils in their body and reconnect to ourselves before we go to bed, so we will be able to close our eyes and to be good night tonight. So if you are sitting or standing or whatever, just let all the parts of your body not crossing like a prana yoga, or is turning your knees, or you're sitting in a chair, and we're going to put our palms all the way up. Or if you're new to this and you don't know how to breathe, you're going to put your left hand on your tummy and your right hand on your chest. And we have oils already, right? You have your environment full of oils, so we don't need more oils. Unless you want to have a special oil, you can do it. There's nothing wrong to have more oils, but we're gonna get ready to go to sleep. So one hand on your belly, the other hand on your chest. I'm going to give directions right now, so then you can do it 3 times, and then we can say good night. And thank you so much for having me over here. So now that we're gonna do our prana, we're going to connect to ourselves. And we are going to breathe in, inhalation through our nose, all the way in where the stomach is going to be expanding. And we're going to hold for 3 seconds. And when we are exhaling, our stomach is going to be contracting all the way to your spine. And that exhalation is going to be longer because we are getting everything out. So are you ready? We're getting it right now. We're going to inhale in 3 seconds. 1, 2, 3, in. Hold it for 3 and exhale in 3 through your nose. Hold it and inhale. 1, 2, 3. Hold it in 3 and release it in 3. Inhale in 3. Hold it and exhale in 3. Open your hands. Namaste. Gracias.
Namaste.
Gracias. Have a great night.
Good night. Good night, everybody.